Joining us for more is Dr. Amesh Adalja, Senior Scholar for the Johns Hopkins Center for Health Security. Great to have you. Anish, what are the most searched questions? Many of these are very basic, but this question at the top of the list, what is the Andes strain of the hantavirus?
So hantavirus has about 50 different versions of it that can infect humans. The Andes strain is one that's endemic in South America, meaning that's the main strain of hantavirus that circulates in places like Argentina. And what's unique about that strain is it's the only hantavirus that we know of that can, in limited circumstances, have the ability to transmit between humans. It doesn't do it very well, but it can do it. And it may be because there's more of a viral load, higher levels of virus in the body when you're infected with Andes. And that's why this is happening. It probably would not have happened if it was another version of hantavirus.
So people are also searching how is hantavirus spread? There seems to be some confusion about this.
So hantavirus is primarily a rodent to human transmission, and then it stops. Humans are what we call dead-end hosts. In this case, it sounds like the initial patient got infected by a rodent, maybe in Argentina or Uruguay or Chile, and then spread it to other individuals. And that happened because it was the Andes version, and it spread to close contacts. And that's not the way that most people get hantavirus. It's usually something where someone is cleaning out an old barn, an old attic, and they get exposed to the droppings of rodents. They get aerosolized. That's exactly what happened to, I think, Gene Hackman's wife, who died of hantavirus in New Mexico recently.
So is there a hantavirus vaccine?
There's not a vaccine for hantavirus. It's one that we need a vaccine for, but it isn't one that we have an off-the-shelf vaccine or even one far in clinical development.
So are we anywhere close? Let's say this continues to spread and it gets worse. I mean, hopefully it will not. But if it does, remember with COVID, how quickly those vaccines were being created. Could we see that happening this time around?
So I don't think it's going to spread in any major manner. I think this is going to be a contained outbreak. But vaccine development has been really revolutionized by the advent of mRNA vaccine technology, by other vaccine platforms. So yes, I think we can do vaccines quickly if necessary. And I don't think that there's an urgent need to do this for the hantavirus, but it would be good to have that vaccine just because hantavirus is something that is worldwide, that kills people every year. It's underappreciated. It's getting headlines now. So it would be a good opportune time to reinvigorate vaccine development for hantavirus.
Yeah, point well made. Okay, one more top search. What are the symptoms of hantavirus?
So the symptoms begin with flu-like symptoms, fevers, chills, muscle aches and pain. And then people kind of get sicker. And that's what's key to this virus, is that it causes the blood vessels around and in the lungs to get leaky, and the lungs fill with fluid. So people may become short of breath, they may develop cough, and then they can have organ system failure, including respiratory failure. But it's that flu-like symptoms that it starts with.
All right, Doc, thank you so much for the insight. We're definitely going to call on you again, and we're going to continue to answer your hantavirus questions throughout the day, including on our new show, Searched. You can tune in right here on ABC News Live every weekday, 4:30 and 6:30 p.m. Eastern.